Dr. Limongelli, let's talk about something which is, I think it's something super important in dentistry. Maybe in my opinion, the most important thing, and that is periodontal disease. And most people, most dentists I know, even when they talk about periodontal disease, they talk about the biggest problem, tooth loss. And while that is a bad thing, for all the reasons I've already mentioned, if you lose a tooth, your bones start shrinking, you start looking old, the teeth start, falling apart like an old fence, and obviously that looks ugly like hell, and all that type of stuff. But while all this is going on, there is the fact of having an infection. And wouldn't an infection be something everybody should fear?
Absolutely. Infections that are caused by periodontal disease can have medical overtones. For example, it's been proven that the bacteria that collect around the necks of the teeth have a deleterious effect on the valves of the heart. And a lot of patients that have mitral valve prolapse or valvular defects in the heart should have antibiotic treatment before they have their teeth cleaned, because a lot of the bacteria get into the bloodstream and collect around the valve leaflets of the heart. In addition to that, systemic diseases such as diabetes mellitus attack the microcirculation of the blood, and the microcirculation around the periodontal ligament of the teeth. What happens, therefore, is that the teeth over a period of time will start to get loose. It can be helped by proper dental hygiene and seeing the dentist to get the teeth cleaned every 6 months. If you do that, you can stay on top of it, and you can avert periodontal disease or prevent it from getting to a severe state where you get a lot of bone loss and the teeth start to loosen.
Okay. Well, again, as I said, that is really, really bad. But what I really, at this moment here, what I really want to talk about it is what I think is a devastating effect. If you have an infection is an infection, whether it is in the finger or in the jaw or in the lung or in the stomach. An infection, by definition, infects other areas and travels around. Am I right there?
Yes.
So we know that the gums and the mouth inside, the cheeks and all that stuff, is literally the gateway to the blood vessels. Go and take some salt or whatever it may be under the tongue, and it instantaneously goes into the blood. Correct?
Yeah, the floor of the mouth and the area under the tongue is very vascular, and a lot of medications can go into the bloodstream directly. That's why one of the places to place a nitroglycerin pill for angina pectoris is under the tongue, where it dissolves and goes into the bloodstream right away.
Okay. Well, what's that thing you just said? The whatever
the nitroglycerin tablets. Well, if you have angina pectoris, which is a constriction of the coronary arteries, it causes spasm and chest pain. Okay. One of the treatments is to dilate those vessels, and the drug of choice is nitroglycerin tablets, and they're usually placed under the tongue sublingually, and they get into the circulation very quickly and cause the vessels to dilate, and the chest pain is relieved.
Exactly. So doctors even place medicine under the tongue. It goes fast in it. I know there are certain particular vitamins and minerals which, if you place them, you feel good right away. It goes right in the blood. Now, if that is happening, if you have that yellow, reddish, ugly buzz, that infection thing, which it basically, if you have a gum disease, that's what you have. You have a red. When you bleed, when you brush your teeth, that means your teeth are infected. You have a ugly yellow buzz. Like, this thing you get when you cut yourself in the finger and it becomes all like yuck, or like you have painful here, it becomes like yellow, reddish, yucky. Well, that's what you have all over here when you have a gum disease, kind of like. Am I right?
Yes, absolutely. When the gums get puffy and start to bleed, it's the first sign that you need a cleaning and you have to get to your dentist quick.
Right. Because if you don't, it stays there and it can, like the medicine, go into your bloodstream. And if it goes into your bloodstream, it obviously goes all over the place. It goes to the kidney, it goes to the liver, it goes to the heart, it goes to the stomach, it goes everywhere. Which is why, and correct me if I'm wrong here, babies get born underweight and all kinds of things because of gum disease. In California, there even was one baby stillborn because they found gum disease things in the placenta of the mom. Yes or no?
Yes, very interesting. Mm-hmm.
So
that's absolutely true.
So basically, never mind losing your teeth, because at least with a little bit of money, or lots of money maybe, you can replace them. But while this is going on, 1 year, 2 year, 3 year, 4 years, you're ruining your body.
It's absolutely true. It's absolutely true, and it speaks for proper maintenance. If you go to see the dentist every 6 months to get cleanings, you can stay on top of it, and you can prevent a lot of the bone loss and a lot of the infection. Also, good oral hygiene. Brushing your teeth at least twice a day, once in the morning, once at night before you go to bed. Using peroxide and mouthwash rinses, which will help to eliminate a lot of the tartar. If the peroxide rinses are done twice a day, they will eliminate tartar formation. Tartar develops from plaque. Plaque is simply food material that you can't clean off the teeth or don't clean off the teeth. It picks up calcium from your saliva and hardens to tartar, which is a plaster-like substance, every 12 hours. So if you brush your teeth and if you rinse good, use a peroxide and mouthwash rinse every 12 hours, you stop the plaque from developing into tartar, which means you can clean it off easily yourself. Peroxide also has another beneficial effect. It helps to shrink the gums a little bit and take the puffiness away. So it's very healing to the mouth.
Okay. So whatever it is, you shall not have an infection in your mouth.
Right.
Okay. Now, by the way, since you mentioned about every 6 months and the data build up and stuff, my dentist, every one I so far had in the last tells me that I have a lots of saliva, and thus I have a lots of data build up, and thus I am supposed to go to a cleaning literally every kind of 3 months instead of every 6 months. And maybe nobody had the guts to tell me that I probably also don't brush enough, at least not compared to my wife. So is there some truth to that also, that if you have more saliva, and they all told me it's very good that you have a lots of saliva. It's basically a very healthy thing. It has, however, a little, kind of side effect that your data builds up faster.
Well, that's true. Like I just mentioned, the plaque will develop into tartar by picking calcium up from your saliva every 12 hours. If you have a lot of saliva with a lot of calcium in it, the tartar formation will occur a little faster. The peroxide and mouthwash rinses do help to control that, but there are a lot of patients that do require cleanings every 3 months instead of every 6 months. The easiest way for you to determine that is to go to see your dentist and go for cleanings every 6 months, and he can evaluate you and see how you're maintaining it. If he thinks you need to come a little more frequently, he'll tell you that. Okay,
all right. So it is really amazing to me, and every time I talk about this topic, I'm amazed and flabbergasted that so many, a dentist doesn't seem to be, and that's what we all think. He only takes care of the good-looking teeth, We already have talked about that, teeth out of alignments. I guess you guys call it malocclusion and whatever. That they can cause you tension in the neck, headaches, pain here. Probably make you ugly looking because you eat crooked. Make you looking caved in because the gums go if they're not there. And now we have added on to that fact that the infection in your mouth is at the gateway of going to the blood vessels, ruins your kidney, ruins your liver, ruins your heart, and can always, with the cause of it, imaginably cause a host of problems, including bringing the immune system down. I've read that a Japanese university researched that people who have gum disease and who also have the HIV virus are much easier to convert the HIV virus into AIDS because of the lowered immune system.
That's right.
Yeah. Now, thanks God, most people don't have the HIV virus, but never mind that. What about the everyday flu, which you want to have a good immune system? And why bring that down with a gum disease, which all you need to do is brush, and of course, if that doesn't work anymore, because it may be too far gone, go and get it cleaned out by the dentist.
That's exactly right.
Just a matter of scraping the dirt out under the carpet. If the vacuum cleaner doesn't do it anymore, lift it and take a little harder brush. And that's basically what the dentist does. Scrapes out that dirt which starts stinking.
Pretty much.
Huh? It sounds all so easy to stay healthy if we just have to, so to say, discipline to do something about it.
That's right. Getting into the habit of doing it.
Well, thanks a lot, Dr. Limongelli.
You're welcome.